Statistics Sierra Leone carried out the sixth round of the Multiple Indicator Cluster Survey in 2017 with financial support from the Government of Sierra Leone, UNICEF, the EU, WFP, UNFPA and WHO. The Multiple Indicator Cluster Survey is an international household survey program developed and supported by UNICEF to collect estimates of key indicators that are used to assess the situation of children and women. Data collection was done May to August 2017 using computer-assisted personal interviewing. The total sample size is 15,605 households, comprising of 74,602 household members, 48% males and 52% females. 15,309 households were interviewed with a response rate of 99.6%. Education. 11.5% of children attend early childhood education, 81.8% attend primary, 36.2% junior secondary and 28.6% senior secondary school. Child from the urban area is 5 times more likely to attend senior secondary school than a child from the rural, and a child from the richest household is 14 times more likely to attend senior secondary school than a child from the poorest household. Completion rates are highest for primary education at 64.2%, followed by junior secondary education at 44.2% and senior secondary education at 21.7%. The disparities are marked among urban-rural areas and among the richest and poorest households. Out-of-school rates are 18% for primary education, 19% for junior secondary education, and 36% for senior secondary. Early childhood development. 11.5% of children attend early childhood education. 12% of mothers and 5% of fathers engage their children in activities that promote learning and school readiness for children, such as reading books to the child, telling stories, singing songs, naming, counting, and drawing with the child. Early childhood development programs are limited and attendance is low in the rural areas 3% and among the poorest populations 1%. 16% of children 7 to 14 years demonstrated good foundational reading skills and 12% good foundational numeracy skills, with higher percentages in urban areas and among the richest. Disparities between boys and girls are minimal for both. Health. Under 5, infant and neonatal mortality rates have in general decreased over the past 15 years. 20 out of every 1,000 children die within the first month of life. 62.7% children are fully vaccinated by 12 months of age, with higher immunization rates in the rural areas. Care-seeking behavior for diarrhea, fever, and pneumonia is highest among uneducated mothers and the poorest households. Nutrition. Stunting is moderately high at 26% and is highest in children in the rural areas 30% and low-income households 32%. Stunting is an irreversible outcome of chronic nutrition deprivation during the first 1,000 days of life, affecting a child's optimal growth and development, resulting in poor brain development, poor school performance, and higher risk to obesity and non-communicable diseases such as diabetes and heart disease later in life. Infants and young children's feeding. Exclusive breastfeeding rate is low at 52%. 24.2% of children aged 6 to 23 months receive 5 of the 8 recommended food groups. Dietary diversity is lowest in rural areas and poor households, and is also influenced by low maternal education. Only 10.8% of children 6 to 23 months can meet their nutrient needs in adequate quantity and quality required to ensure healthy growth and development. Water and sanitation hygiene. 58% of households have access to basic drinking water, 16.4% access to basic sanitation, and 23.3% to basic hygiene. Area of residence and mother's educational level contributes immensely to access to water, sanitation, and hygiene facilities. Women are primarily responsible for collecting water for the household, 60%. 33% of water collectors spend over 3 hours collecting water each day. Open defecation is practiced by 17.1% of the population, with prevalence in rural areas, 28%, poorest households, 46%, and the uneducated, 22%. 20.1% of women 15 to 49 years did not participate in social activities, school, or work due to their menstruation in the last 12 months. This was highest in girls 15 15 to 19 years. HIV and sexual behaviors. 2 in 5 pregnant women with a live birth in the last 5 years received HIV testing and counseling and the results during an antenatal care visit. Sex before age 15 among women 15 to 24 years was highest in rural poor areas, 22%, and among the uneducated, 26%. Birth registration. Registering children at birth is the first step in securing their recognition before the law and safeguarding their rights. Birth certificates are the first form of legal identity and are often required to access healthcare or education. 81.1% of children under the age of 5 are registered, among which 52.9% have birth certificates. Mother's education, wealth, status, and area of residence contributed to children being issued birth certificates. Early marriage. 1 in 5 adolescent girls aged 15 to 19 are currently married. 10% were married before age 15 years and 28% before age 18 years. Adolescents. Amongst girls aged 15 to 19 years, modern contraceptive use was more prevalent for unmarried girls, 54%, than for married girls, 14%. 19.3% of women aged 15 to 19 years had a live birth, and 3.9% were pregnant with their first child. In child functioning, children 10 to 14 years were more anxious, 13.3%, and depressed, 9.6%, than children 15 to 17 years. Anxiety, 11.1%, depression, 8.0%. 44% of children 15 to 19 years are involved in hazardous work. Alcohol and tobacco usage is generally low among adolescents, with boys 2%, twice as likely to consume alcohol and tobacco than girls 1%. Female genital mutilation or cutting. 80% of women aged 15 to 49 years have some form of female mutilation or cutting, with higher prevalence in the rural areas, 92%, than in the urban areas, 80%. 68% of these women thought that the practice of female genital mutilation or cutting should continue. Child labor. 39% of children 5 to 17 are involved in child labor, with very little disparity among boys, 39%, and girls, 38%. Child labor is substantially higher among rural children, 51%, children who are not attending school, 47%, and those in the poorest wealth quintile, 58%.